Welcome to Have More Babies. Today we're looking at something really fundamental a listener asked about. What exactly is a pediatrician? I mean, we know they're doctors for kids, but what does that really involve? What's the specialization?
Right. It's a great question because it seems simple, but there's a lot underneath.
The source material we got definitely points to pediatric care being, well, synonymous with children's healthcare. It talks about this complex system for dealing with kids going through all these rapid physical and mental changes.
Exactly. And they usually see patients from birth right up until maybe 21 years old.
Okay, so let's try and unpack that. What's the simplest, most basic definition we can start with for this role?
Well, I think the simplest answer is actually pretty profound. A pediatrician is a medical doctor, yes, but one who's specifically trained beyond the basic physician level. Their whole focus is geared towards managing the total health and well-being of newborns, kids, teens, right up to young adulthood.
Okay, beyond basic training.
Yeah. And our goal here, I think, is to really get past that surface idea of just a kid's doctor and show the huge commitment and the really broad scope that's involved in pediatrics.
That holistic scope you mentioned, the sources really emphasize that. It sounds like it's not just about prescribing medicine. So what are the main pillars of care they're trained to provide? The materials seem to break it down into three core areas.
That's right, three crucial types. First, there's the obvious one, medical care for acute and chronic illness. So that covers everything from, the common cold or an ear infection, right up to managing really complex long-term conditions, and also coordinating care, say, after a kid gets out of the hospital. That's a big part of it.
Okay, so treatment and management, what's the second one?
The second pillar is preventive care. This is huge in pediatrics. Think immunizations, health screenings, keeping track of growth, developmental milestones, all that regular well-child checkup stuff.
Right, trying to catch things early or prevent them altogether.
Exactly. And the third pillar, which sort of ties it all together, is coordination of care. They really look at the child as a whole package. It's not just the sore throat today. It's about their mental, physical, and emotional well-being.
That whole package idea, it connects to something interesting in the notes. This approach, managing everything, not just disease, it's based on a World Health Organization definition.
Yeah, the WHO definition of child health. And what's kind of amazing is that the core definition they use, the one that emphasizes this broad well-being, it hasn't fundamentally changed since 1984.
1984, wow, that's actually surprising it's held up that long in medicine.
It is, but it speaks to how forward-thinking that definition was. It really locked in the idea that health isn't just the absence of disease. It's physical, mental, and social well-being.
Okay.
And that's why you see pediatricians getting involved beyond just the clinic room. They might connect with school nurses, counselors, sometimes even law enforcement if there are safety concerns. It's part of that mandate.
So their role really extends quite far. It's advocacy too, then.
Absolutely. Advocating for the child's needs, promoting things like basic hygiene, immunizations. It's all part of that holistic view rooted in that older WHO definition.
Okay, that makes sense. So this leads to a really important question, I think. If they have this wide scope, what's the biggest advantage of having a pediatrician specifically versus maybe a family doctor who also sees kids? The material called them the first to notice.
That phrase, first to notice, I think that really nails it. That's the key advantage.
And how does that happen? The sources mention it's because they build this long-term relationship, this communication channel with the child and the parents.
Precisely. It's that continuity of care over years. They see the child grow, they know the family dynamics, they build trust. That strong communication channel lets the doctor really listen not just to the symptoms the parent reports, but also observing interactions, picking up on subtle cues. It might even involve, respectful discussion or counseling for behavioral things.
Right, okay. And being the first to notice, the sources break this down. They're spotting irregularities in, 4 key areas.
Yeah, 4 main categories where their specialized focus helps them see things early.
Okay, what are they?
First is physical issues. This could be subtle things, maybe like minor physical deformities that might indicate a larger syndrome, or even just tracking growth patterns that seem off. Second is mental health. Things like early signs of anxiety or depression that might look different in kids than adults.
Okay.
Third, behavioral issues. This is a big one. ADHD, signs pointing towards autism spectrum disorder, other developmental delays.
Things a parent might see but not know how to interpret.
Exactly. Or might attribute to just being a phase. The pediatrician has the framework to assess it more objectively. And fourth is Functional problems. Think things like persistent bedwetting well past the typical age, or maybe really severe temper tantrums that seem out of line developmentally.
Got it. So their main goals, reducing child mortality, advocating for kids, promoting health measures like vaccines, it all seems to stem from this ability to notice things early because they're so focused on this specific age group.
That's a perfect way to put it. Early detection is the foundation.
Okay, let's talk about the path to becoming this kind of expert. It's clearly a massive commitment. What does the training actually look like after high school? The sources mention two distinct phases.
Oh, it's a long haul, definitely. You're looking at 9 to 11 years minimum after high school.
9 to 11 years, wow.
Yep. So phase 1 is just becoming a medical doctor, an MD. That's your standard undergraduate degree, usually 4 years, followed by 4 years of medical school. Sometimes those are combined programs, maybe 6 or 7 years, but it's a significant block of time just for the basic medical degree.
Okay, so that gets them the MG. Then comes the specialization.
Then comes phase 2. The pediatric specialty training. This is the crucial part. It's a required residency program specifically in pediatrics. To get board certified, you have to complete this, and it takes an additional 3 years.
3 more years focused just on kids.
Focused just on kids, and it's highly structured. It's recognized and accredited by the ACGME, that's the Accreditation Council for Graduate Medical Education. So it's a standardized, rigorous training across the country.
Right, ACGME, good to know there's that oversight. And this residency, it's not just books, right? The sources highlighted the sheer amount of hands-on experience.
Not at all just books. This is where the rubber meets the road. Pediatric residents are required to put in somewhere between 12,000 and 14,000 hours of actual patient care during those 3 years.
12 to 14,000 hours.
1,000, yeah. Direct, supervised patient care. Think about that. It's an incredible amount of practical experience, seeing everything from well baby checks to really complex pediatric emergencies.
That explains the depth of knowledge. You see a lot in 14,000 hours.
You really do. And the learning doesn't stop after residency, of course. There's ongoing, continuing medical education conventions, new research, self-assessment. They have to stay current. Medicine changes fast.
It definitely does. And healthcare itself has gotten more complex, leading to even more specialization within pediatrics, right?
Yeah.
The sources mentioned subspecialties.
Yes, absolutely. As our understanding grows, pediatric care has segmented further. So after the general pediatric residency, some doctors go on for more training in a subspecialty. This is really important for listeners to know about if their child has a specific or complex condition.
Okay, so what are some examples of these subspecialists? The material listed a few key ones.
Right. One big one is neonatologists. These are the experts for newborns, particularly in the first month of life. They often work in the NICU, the neonatal intensive care unit, caring for premature babies or infants born with serious health issues. Really tiny, fragile patients.
Okay, NICU doctors. That makes sense.
Then you have pediatric intensivists. These docs specialize in critically ill children beyond the newborn stage. They typically work in the PICU, the Pediatric Intensive Care Unit.
PICU, right.
Yeah, they manage kids who are extremely sick, maybe on ventilators, dealing with major trauma or complex post-surgical care. It's high-stakes intensive care.
And there was another one focused more on development and behavior.
Yes, developmental behavioral pediatricians. Their focus is squarely on, well, developmental and behavioral issues. Things like diagnosing and managing learning disorders, dyslexia, autism spectrum disorder, ADHD, even complex issues like school avoidance or anxiety in teens.
That segmentation really highlights why tracking those standard developmental milestones is so important from the start, doesn't it? You know, when kids are expected to walk or talk.
Absolutely. The general pediatrician is often the first line for monitoring those milestones. They use screening tools during well-child visits precisely to catch potential delays early. They really are the perfect ally, as the source material put it, for parents navigating that.
Okay, perfect ally. I like that. Now, we touched on this earlier, but we should probably tackle it head on. The difference between a pediatrician and a family physician. Because it could be confusing, right? Can a family doctor basically be a pediatrician for your child?
It's a super common question, and the answer is nuanced. As the source material suggests, yes, a family physician can provide pediatric care.
Especially if they have a good amount of experience or a particular interest in treating kids, maybe in areas where pediatricians are less common.
Exactly. But the core difference boils down to the focus and the depth of their training and daily practice.
So let's break that down. What's the main distinction?
Okay, first, the obvious one. Age of patients. Pediatricians, as we've said, specialize only in patients from birth up to about 21. Their entire focus is on that developmental spectrum. Family doctors, on the other hand, are trained to treat patients of all ages: infants, kids, adults, elderly folks. Their certification comes from the American Board of Family Medicine, reflecting that broader scope.
All ages versus just kids and teens.
Got it. And that difference in patient population directly impacts the expertise and training depth.
How so?
Well, those 3 years of pediatric residency are spent immersed solely in childhood illnesses, growth, development, behavior. Pediatricians just naturally gain deeper, more specialized knowledge and experience in conditions unique to children. Think about dosing medications for a rapidly growing toddler versus an adult. It's very different.
Right, the physiology is constantly changing.
Constantly. Family doctors have incredibly broad training. They have to cover internal medicine, some OBGYN, adult chronic diseases, and pediatrics during their residency. They have a wider lens, which is great for seeing the whole family context, but generally means less concentrated experience with purely pediatric conditions compared to a pediatrician.
So more depth in kids' issues for the pediatrician, more breadth across ages for the family doc.
That's a good way to summarize it. Family docs might have more experience managing adult conditions like diabetes or high blood pressure across a lifespan, while pediatricians will have seen many more cases of, say, specific childhood developmental disorders or congenital conditions.
Okay, so when you're choosing, it seems like picking a pediatrician is really about opting for that deep, specialized focus on the unique needs of a growing child. The idea is that this specialized attention, that trusting relationship, leads to better outcomes through that crucial early intervention.
Precisely. You're choosing someone whose entire professional world revolves around understanding and caring for developing humans.
Yeah.
So wrapping this up, what does it all mean for you listening right now?
I think it means recognizing that the pediatrician plays this incredibly vital role in really securing a healthy future for our kids, for the next generation.
Yeah.
They really are equipped to be that perfect ally for parents, bringing years of very specific, very focused training to the table. And for anyone wanting more practical tips or resources maybe about specific services pediatricians offer, like the notes mentioned circumcision or ear-piercing guidance, the source material we used has a lot more detail.
It does. And here's maybe a final thought to leave you with. Just remember those training hours we talked about. 12,000 to 14,000 hours of hands-on care just during residency. When you choose a pediatrician, you're not just getting a doctor. You're really choosing a highly trained developmental expert, someone whose judgment is sharpened by years dedicated solely to kids.
That's a powerful way to think about it. And if you are looking for a pediatric practice that really seems to embody that comprehensive care and dedication we've been discussing, we absolutely encourage you to visit omegapediatrics.com. That's O-M-E-G-A, pediatrics.com. They have a wealth of resources online, and they even talk about a 3D model of access, which sounds like they're really focused on being reachable and supporting families. So definitely check them out, omegapediatrics.com.
And if you found this discussion helpful today, please do us a favor. Like this video, subscribe to the channel so you don't miss future conversations.
And share this with anyone you know, parents, expecting parents, caregivers who might find this information valuable as they navigate healthcare for their kids.
Absolutely.
Well, thanks for joining us for this look into the essential world of pediatric care. We'll see you next time.